new research is coming out about some of the positive impacts of GLP-1s, including whether it could be used to help treat addiction to alcohol or opioids. Some doctors already prescribing this off-label for this purpose. One small study on people addicted to opioids showing GLP-1s reduced their cravings for the drugs by 40% over 3 weeks. A second study found people addicted to opioids or alcohol who took GLP-1s had a 40% lower rate of opioid use and a 50% lower rate of alcohol intoxication. Let's bring in Dr. Anahita Dua now, founder and chair of Healthcare for Action. She's a vascular surgeon and associate professor of surgery at Harvard. Dr. Dua, great to see you again. We know that GLP-1s work on the brain's dopamine reward system. It's one of the reasons that it works with people who have food addiction, although that is not formally recognized by the DSM-5 yet. Explain this to us. Working on dopamine, is that why GLP-1s may help people addicted to alcohol, to nicotine, to cigarettes, etc.?
Exactly. That's exactly the reason why we say that it works. Essentially, what the drug does is work on the gut and work on the brain. And when it works on the brain, what it specifically does is it lowers the dopamine aspect of things. And dopamine is what makes you happy. It's what makes you crave things. It can ultimately lead to things like addiction, people chasing that dopamine high. And so by dampening that response, people decide that they don't want to take the alcohol, don't want to take the drug, don't want to eat, as you said, because they're not getting the same high, quote unquote, that they would get if they were not on the drug. And so that encapsulates really the reason why this drug works. But as was said earlier, it is important to determine which patients specifically benefit and which ones may actually have a higher risk by taking these types of medications. And that will be with further research.
Interesting. So if GLP-1s generally dial down the brain's reward system, could that have unintended effects on motivation or drive or how people experience pleasure?
Yes, very much so. In fact, that's the area that's not been studied as much. As you can see now, we're beginning to do that. There's been a number of what we call, quote, patient life years, millions, in fact, that we've studied that really focus on the gut side of things. But now we're learning more and more about the brain. And what we don't know is what does 40 years of a dampened dopamine response do to a person. And there's really no way to quite understand that until we get 40 years out. There are, of course, simulations and mechanisms by which we do study these types of things because we don't want to withhold a drug that can help people for 40 years till we figure it out. But it is important to understand those risks. And indeed, the effect it can have on pleasure, as you mentioned, of all regards, including from food, potentially from sex, potentially from things like as you mentioned, things that can cause addiction, we really don't know yet.
It's interesting. We know at least one biotech company called Baseline Therapeutics is already looking to specifically test whether GLP-1s can help with alcohol and with opioid addiction. For now, some doctors are already prescribing this off-label for people who struggle with addiction. And of course, we know that fentanyl, for example, has been so devastating for so many American families. What would you say to someone who looks at these headlines and wonders if it could help them or if it could help a family member?
I would say talk to your doctor about it. Really understand how the drug works. And of course, all of us physicians really do understand at this point because, as you mentioned, so many patients are on it. But I can tell you, even as a vascular surgeon, almost on a week-to-week basis, we are changing our rules and regulations about what type of medications patients can be on before we even offer them anesthesia and surgery, because we are also learning in real time. So what I would say to someone is this can really potentially help. As you mentioned, fentanyl addiction is something that can kill somebody. And if there's a small risk of 40 years from now, there might be a little bit of a dampened pleasure response, that might very well be worth it. So I would say speak to your doctor, learn a little bit more about it, and understand how the drug actually works in order to determine whether it's right for you.
Yeah, Dr.